Hi friends, welcome to Med Clarity. So today we are going to see about the surface anatomy of the thoracic cavity. So the first surface anatomy we are going to see here is the parietal pleura. So in the parietal pleura, first we are going to see about the cervical pleura. Okay, so you have to take the right sided clavicle here. Okay, and you have to mark the medial 1/3 of the clavicle. So you have to mark one point here, and you have to mark one point here, and you have to draw a doom 2.5 centimeter over the clavicle. So this becomes the cervical pleura. And then you're going to see about the parietal pleura's margin. So the first margin will be the anterior margin over the right side, and then anterior margin over the left side. Okay, so the parietal pleura anterior margin over the right side, the first point you have to mark near the right point along the dome of the cervical pleura, second point along the right sternoclavicular joint, and third point along the xiphisternal joint. So you have to join all these 3 points. So this becomes the anterior margin of the parietal pleura towards the right side. Okay, now you are going to mark the anterior margin of the parietal pleura towards the left side. Okay, so towards the left side, the first point will be along the left dome of the cervical pleura. Second point, left sternoclavicular joint. Third point will be at the level of the left fourth costal cartilage. And fourth point will be at the level of the left sixth costal cartilage. Okay, so you have to join all this line. So when you come along the left fourth costal cartilage, and you have to draw a half semicircle up to the left sixth costal cartilage, and it has to extend downwards up to the xiphisternal joint. Now you are going to draw about along the inferior margin. Okay, so the inferior margin towards the right side, the parietal pleura of the inferior margin towards the right side, you have to take one point at the level of the right xiphisternal joint. Then it descends downwards, and you have to mark the point at the level of the 8th rib at the mid-clavicular line, 10th rib at the mid-axillary line, and then 12th rib along the sacrospinalis muscle along the posterior side. Okay, so the first point will be at the level of the xiphisternal point. Second point will be 8th rib at the midclavicular line. Third point will be 10th rib at the mid-axillary line. And the last point will be 12th rib, the lateral border of the sacrospinalis muscle. Okay, so it will come at the back. At the 12th rib at the sacrospinalis muscle will be the inferior margin ending point. Now we have to see the posterior margin of the parietal pleura. Okay, so the posterior margin of the parietal pleura, the first point, it starts 2 centimeter lateral from the 12th vertebra, and it ascends upwards up to the 2 centimeter lateral to the C7 cervical vertebra. So joining these two lines will be the posterior margin. So the inferior margin and the posterior margin of the parietal pleura will be same on both the sides. Clear? So this is the surface marking of the parietal pleura. Okay. So next we are going to see about the surface anatomy of the lungs. And first you are going to see about the surface anatomy of the right lung. The apex of the lung, it remains same as the cervical pleura. Okay, so the medial 1/3 of the clavicle, you will be drawing a dome 2.5 centimeter above the clavicle. And then towards the right side of the anterior margin of the lung, you will be starting from the dome of the pleura. The first point will be dome of the pleura. Second point will be right sternoclavicular joint. Third point will be xiphisternal joint. So joining all these line, it becomes the anterior margin of the right lung. And coming towards the anterior margin of the left lung. Okay, same as it, you will be tracing the first point at the level of the left dome of the cervical pleura. So the first point you have to keep at the level of the left dome of the cervical pleura. Second point will be left sternoclavicular joint. Third point will be left fourth costal cartilage. And fourth point will be left sixth costal cartilage. And fifth point will be left xiphisternal joint. So joining all these lines will be the anterior margin of the left lung. So when it comes near the left fourth costal cartilage, it forms the half semicircle and it joins with the left sixth costal cartilage. So this becomes the cardiac notch, and this is the area of the superficial dullness. Okay, so here it lies both the double layers of the pleura. And then from the sixth costal cartilage, it descends up to the left xiphisternal joint. So this becomes the anterior border of the left lung. And next you can see the inferior border of the right and the left lung. So the inferior border of the right and the left lung, it lies same on the both the sides. Okay, so in the pleura you have seen right xiphisternal joint, 8th rib at the midclavicular line, 10th rib at the midaxillary line, 12th rib at the lateral border of the sacrospinalis muscle. So here the inferior border of the lung, you can see the 6th rib at the midclavicular line, 8th rib at the midaxillary line, 10th rib at the lateral border of the erector spinae muscles. Okay, so side also same surface marking, left xiphisternal joint, and then the inferior border of the left lung will be 6th rib at the level of the midclavicular line, 8th rib at the midaxillary line, 10th rib at the back, okay, at the level of the 10th thoracic spine. Okay, so the posterior border of the lung, it'll be remaining same for both the sides. Okay, so coming to the posterior border of the lung, instead of the 12th thoracic spine, the lung will be starting at the level of the 10th thoracic spine. So it starts at the level of the 10th thoracic spine, so it ascends upwards and it ends at the level of the 7th cervical spine. In parietal pleura, the posterior margin starts at the level of the 12th thoracic spine, whereas the lungs, the posterior border, it starts at the level of the 10th thoracic spine. Next you can see the oblique fissure on both the sides of the lungs. Okay, so the first point will be at the level of T3 thoracic spine. Second point will be at the 5th rib at the midaxillary line. Third point will be at the level of the sixth costal cartilage from the median plane. So from the median plane, it's up to the sixth costal cartilage. So drawing all these lines, it becomes the oblique fissure on both the sides. Now we'll be seeing about the horizontal fissure towards the right side. Okay, so in the right side you can see the first point will be at the level of the fourth costal cartilage. Second point will be at the level of the fifth rib at the mid-axillary line. So now we'll be seeing about the surface marking of the heart. So you have to first draw the borders of the heart. Okay, so the first point you will mark along the lower border of the left second costal, the first point. Okay, and the second point you have to mark along the upper border of the third right costal cartilage. Okay, and third point you have to draw one median plane in the middle. You have to draw one median line in the middle, and from the median line up to the fourth intercostal space. So this is the first point, which is at the lower border of the left second costal cartilage, and the second point will be upper border of the third right costal cartilage. Third point, you have to draw a median plane. From the median plane up to the fourth intercostal space, you have to draw one point. This is a third point. And fourth point will be towards the right sixth costal cartilage. So the lower border of the right sixth costal cartilage, just 2 centimeter from the midline. Okay, and apex of the heart will be along the fifth intercostal space, 9 centimeter from the mid-sternal line. Okay, so now you have to draw the upper border. So the upper border will be, like you can see the 2 points here. The first point will be lower border of the second costal cartilage. Second point will be upper border of the third right costal cartilage. So joining these two lines, it becomes the upper border. And next you can see the lower border. So the lower border you can see the third point will be at the level of the fourth intercostal space from the median plane. Okay, so just below that is the sixth costal cartilage. Okay, and from the sixth costal cartilage you have to draw a line up to the fifth intercostal space, that is at the apex of the heart. So joining these two lines, it becomes the lower border, that is 0.4 and the 0.5. Okay, and then you can see the left border. So the left border will be joined from the 0.1 to the 0.5. So 0.1 to 0.5 will be the left border, and then you can see the right border. So 6. So this is the borders of the heart. Clear? So the first point will be lower border of the left second costal cartilage. Second point will be upper border of the third right costal cartilage. Third point will be right fourth intercostal space, and then fourth point will be right sixth costal cartilage. Okay, so joining the point 1 and the point 5, the fifth point will be apex of the heart, that is at the level of the fifth intercostal space, 9 centimeter from the mid-sternal line. Okay, so you have to draw from the point 1 to the point 5. So this will be the left border, and point 2 to the point 4. So this will be the right border, and point 1 and point 2, if you join both of these lines, it becomes the upper border, and then fourth point and the fifth point. So joining this both lines, it becomes the lower borders. So these are all the borders of the heart. Okay, so next we can see the cardiac valves. So there will be 4 cardiac valves: the pulmonary valve, aortic valve, mitral valve, and the tricuspid valve. Okay, so the surface marking of the pulmonary valve, it will be like at the level of the third left costal cartilage. So this point, just below the second left costal cartilage, will be the third left costal cartilage. So this point will be the pulmonary valve. So where will be the auscultation point? Just above the third left costal cartilage will be the auscultatory point, that is along the left intercostal space, left sided second intercostal space. Next you will see the aortic valve. So aortic valve, it starts from the third left costal cartilage. Okay, so here you can see the third right costal cartilage, and then third left costal cartilage will be the aortic valve. The auscultatory point will be the right third costal cartilage. Okay, then coming to the mitral valve. So mitral valve will be along the left side of the fourth intercostal cartilage. Okay, and the mitral valve will be left fourth costal cartilage, and tricuspid valve will be opposite the fourth and the fifth intercostal space. So just opposite the fourth and the fifth intercostal space, you can see the tricuspid valve. Okay, now you are going to see about the surface marking of the superior vena cava. Okay, superior vena cava, you have to keep one point, the first point at the level of the right side of the sternoclavicular joint. Okay, so at the level of the first costal cartilage, you have to keep one point. Then at the level of the third costal cartilage, you have to keep one point, and you have to draw 2 parallel lines. So this becomes the surface marking of the superior vena cava. Okay, and then I'll be explaining about the surface marking of the internal thoracic artery. The first point you have to draw at the level of the first sternoclavicular joint. Second point you have to draw at the level of the the sixth intercostal cartilage. Third point will be sixth intercostal space. So you have to join all these 3 lines. At the level of the sixth intercostal space, it divides into 2 arteries. The one will be the epigastric artery, and another one will be the musculophrenic artery. So the musculophrenic artery will be supplying the diaphragm. Epigastric artery will be supplying the upper part of the abdomen. So this is the surface marking of the internal thoracic artery. So hope you understood all. So I'll just give a recap of the surface anatomy of the heart, lungs. Okay, so here you can see the surface anatomy of the lungs. The lungs has an anterior border, posterior border, inferior border. So towards the anterior border, right sternoclavicular joint, right dome of the cervical pleura 1 point, right sternoclavicular joint 1 point, right xiphisternal joint 1 point. So joining all these lines will be the anterior border towards the right side, and then anterior border of the left lung. You can see you have to draw first point at the dome of the cervical pleura, second point at the left sternoclavicular joint, third point at the left fourth costal cartilage, fourth point at the left sixth costal cartilage. So between the left fourth and the sixth costal cartilage, you have to draw a semicircle that becomes the cardiac notch. It's the area of the superficial dullness. On the inferior and the posterior margin, it remains same for both the sides of the lung. Okay. So inferiorly, if it is a pleura, it will be at the level of the 8, 10 and 12. 8th mid-clavicular, 10 mid-axillary line and 12th will be the T12 thoracic spine and the rib. So comparing to the lung, the inferior border of the lung will be at the level of the 6, 8 and 10. So 6 will be at the level of the mid-clavicular, 8 will be at the level of mid-axillary. So 6th will be at the level of the mid-clavicular, 8th will be at the level of mid-axillary line, 10th will be at the level of the lateral border of the erector spinae muscle. Posterior margin, the posterior border of the left lung, it starts from the T10 spine to the ascends upwards up to the C7 cervical spine. And parietal pleura posterior border, it starts from the T12 thoracic spine, ascends upwards up to the C7 cervical spine. So this is about the pleura and the lungs. And coming to the surface marking of the heart, you have to draw one point at the level of the lower border of the left second costal cartilage, and you have to keep one point. The first point will be lower left second costal cartilage, second point will be upper border of the right third costal cartilage, third point will be right fourth intercostal space, fourth point will be right sixth costal cartilage, and fifth point will be 9 cm from the mid-sternal line, and this is apex of the heart, which lies at the level of the fifth intercostal space, left fifth intercostal space. So joining the first point and the second point, it becomes the upper border. Joining the fourth point and the fifth point, it becomes the lower border. And joining the first point and the fifth point, it becomes the left border. Joining the second point and the sixth point, it becomes the right border. So this will be the borders of the heart. And coming to the valves of the heart, the pulmonary valve, it lies along the third left costal cartilage. Aortic valve, it lies along the right costal cartilage, and then mitral valve just opposite to the left fourth costal cartilage. Tricuspid valve, it lies between the fourth and sixth intercostal spaces. Thank you for watching.